So a question from Julia. I am a breast cancer patient still going on chemotherapy. What's the best food and vitamins for me to take?
Yeah, so this is a good question. A lot of people ask. So breast cancer is obviously, unfortunately, very, very common, and a lot of our questions that I saw come in ahead of time were about breast cancer. So specific to breast cancer, the couple of things that you're going to want to make sure that you are doing is monitoring your weight. It's Breast cancer is one of the few where people are likely to gain weight during treatment, and it's a little bit, the research shows that the more weight that you gain, if you gain more than around 12 or 15 pounds, you have worse outcomes. So you want to make sure that your weight gain stays somewhere under that 12 to 15 pound mark. You don't necessarily have to lose weight during your treatment, but it can be beneficial and it can be something that is discussed with your doctor. So that's the first kind of thing that I would talk about is just general weight maintenance during breast cancer treatment. The next thing that I would want to mention again is that soy isoflavone piece that I mentioned. So soy gets a little bit of it's kind of was debated whether or not breast cancer patients should be having soy because it does have plant estrogen in it. And lots of types of breast cancers are responsive to estrogen, or they have estrogen receptors on the cells. But it's really important to note that the kind of estrogen that's in soy is totally different and acts totally different in the body than human estrogen does. And what it will actually latch on to the breast cancer cells and block the estrogen from getting in there, which can have beneficial effects. So patients with breast cancer are encouraged to have at least 1 to 2 servings of a whole soy food product every day. So that could be soy milk, tofu, edamame, tempeh, anything like that is going to be a good soy choice. You want to generally steer away from like soy protein powders, soy isolate, just because that hasn't been as well studied with its effect on breast cancer. Additionally, there's been some pretty good research on flax seeds. So flax seeds are really high in one of those phytonutrients I talked about called lignans. And so it's generally recommended that all women, but especially women with breast cancer, have 1 to 3 tablespoons of ground soybean or flaxseed meal every day. So that's a really good source of those omega-3 fats. It's going to have those lignans, and it's also a good source of fiber. So you get a 1, 2, 3 punch of good cancer fighting medicine with some flax seeds. In terms of vitamins to take, I know that was kind of the second part of Julia's question. It depends. So with all cancers, before you decide to take any vitamins, any supplements, any herbal products, you should always discuss with your doctor. And I know I'm going to say that probably 18 times today, but each person's suite of medications that they're on is very different. And a lot of those different especially the herbal products, are going to have different interactions with different kinds of medicines. So you always want to make sure that if you decide to take something, it's safe and that it's not interfering with your cancer treatment itself. That being said, there is a little bit of research that says that breast cancer patients specifically, if they take a multivitamin 3 times a week, it doesn't have to be every day, just 3 times a week, that it can have beneficial effects for your treatment. You just want to make sure that that vitamin supplement is good quality, that it's from a reputable source, and that it's not going to be contaminated with anything, because that has happened in the past.
I'm sure that really helped Julia with her concerns.